going to be your nurse for today. I'm just going to be giving you an injection intramuscularly. I'm going to provide privacy. Can I get your name and date of birth?
Stephen Brazelton, 12/21/67.
Okay, can I check your wristband? Okay, it matches. I'm going to do hand hygiene. I'm going to assess the MAR and assess for allergies, assess the vital signs, any associated labs. I'm going to also compare the MAR to my medication that I have at the bedside and making sure that it is the right medication, and I'm also going to go through my 6 rights of medication administration, which is right medication, right dose, right time, right route, right client, and right documentation. So, to start off, I'm going to explain to my patient why he's getting this medication and any possible adverse reactions or side effects. And then I'm going to come back and I'm going to check my MAR and compare it to my medication again. And then, one second. I'm going to clean off my vial because it has been used before. Okay, I'm going to be injecting 1 milliliter today, so I'm going to draw 1 milliliter of air. I'm going to check that. And normally I would be removing the blunt cannula and placing a needle on here, but in this situation we cannot do that. So I'm just going to put that back there. And I would determine where the previous injection was given, looking for any signs of inflammation, trauma, or lesions, and making sure it was not near any bony prominences. And now I'm going to demonstrate the way to find the intramuscular injection sites. So I'm going to have my patient lie on his side. And I'm going to do the first site, which is ventrogluteal. So I'm going to place the palm of my hand on the greater trochanter, putting my index finger on the anterior superior iliac spine, and my thumb pointing towards the groin and my fingers pointing towards the head, moving my middle finger back onto the iliac crest, and the injection site is between the triangle. Okay, you lie on your back now, and this is the vastus lateralis site. So you want to have them have their leg bent with the leg that you're going to be giving the injection at. Now place one hand above the knee and one hand below the greater trochanter of the femur. And I'm going to find the midline of the anterior leg or anterior thigh, and then the midline of the lateral thigh. So it's going to be about in this area. That's the injection site. And then the last one is his deltoid. So you see that? Just really short. Okay, so I'm going to place my hand at the edge of the acromion process, and I'm going to make it a triangle. So the injection site is within this area. Okay, and then, so I'm going to compare my medication once again, one last time, to the MAR, making sure it is right. And it is. I'm going to and you want to make sure that their arm is relaxed and bent at the elbow also. So I'm going to be using this towel as my patient for this. So I would hold the syringe in my dominant hand as if I was holding a dart, and I would put it at a 90-degree angle, inserting it quickly and firmly, and then removing it. But before I injected it, I would have aspirated for blood if that was indicated, but in this case it was not. So I'm going to remove my needle and release the skin. But if I was doing a Z-track, I would wait 10 seconds before withdrawing the needle, but once I withdraw the needle, I would immediately release the skin. I'm going to apply gentle pressure, watching for bleeding, and then I'm going to make sure that the safety mechanism is in place on the needle, and then I would dispose of that in my sharps container, in the appropriate sharps container. So I'm going to remove my gloves and do hand hygiene again. Okay, you can put your shirt back on there. Okay, I would document on the MAR the medication administration date and time, and the route of medication administration, the site of medication administration, the dosage of medication administration, the family and client teaching, and the client's response to the medication. And then if the patient did not, if the patient refused the medication, then I would note that in my nursing notes and the reason for